Welcome to Virtual Face-to-Face with President Bruce Jarrell. I'm Alex Lukowski, VP of Communications. I'm sure you've seen the headlines this fall. Nurses, workers launch 5-day strike at 3 HCA-owned hospitals. Howard Brown health workers begin 2-day strike. Kaiser Permanente strike underway. And it's the largest healthcare strike in history. And that last bit, by the way, was actually part of the headline. A coalition of 11 Kaiser unions across the U.S. representing 85,000 workers walked out for 3 days in October. Patient care is in crisis at Kaiser Permanente, said Linda Bridges, president of one of the unions in the coalition, OPEIU Local 2 in Silver Spring, right here in Maryland. Staffing was decimated, she said, during the pandemic, and it has not gotten any better. In fact, nurse-to-patient ratios seem to play a role in nearly every nursing labor dispute. The issues are a little different, of course, in each situation, but a survey of more than 2,000 nurses polled for Nurse.org's 2023 State of Nursing report reveals 9 out of 10 think the nursing shortage is getting worse, and 8 out of 10 said their own units are understaffed. Although most of those surveyed said they did get a pay increase in the last year, 3/4 said they still feel underpaid. And interestingly, when asked what would have the most impact on reducing turnover, more nurses said improved staffing ratios than said increased pay. So it shows where their priorities are. Now, earlier this year, nurse staffing company AMN surveyed more than 18,000 RNs and found about a third were seriously considering leaving nursing, largely influenced by pandemic-induced issues like burnout. Nurses are retiring at higher rates, partly due to just demographics. And the Bureau of Labor Statistics says the U.S. should expect more than 190,000 openings on average for each of the next 10 years just for registered nurses. Now, the good news is those surveys and other data all show that most nurses love their jobs, and job satisfaction seems to improve with higher education. So what does the future of nursing look like? And more specifically, what will nurses' roles look like in the future? Because that certainly continues to change. Now, there are some clear trends in healthcare, of course. Telemedicine exploded during the pandemic and remains largely popular and insurable, at least for the moment. And an aging population will likely want to keep that going with increases in home healthcare. And we can reasonably expect the ascendancy of AI to impact not only nursing informatics, but also really administration, research, even clinical care. Improvements in virtual simulation technology may also bolster online learning. And according to the American Association of Colleges of Nursing, employers are already showing a strong preference for higher education, which is likely to increase. AACN says a quarter of all hospitals already require new hires to have at least a BSN, and more than 2/3 strongly prefer it. The average job offer rate for master's level graduates is more than 82% right at graduation and 96% within 4 to 6 months, so that's good news. And finally, the trend certainly continues that is so well encapsulated in this newspaper headline, one of my favorites: the doctor of nursing practice will see you now. The BLS says America has about 250,000 NPs, and although half of them work in physicians' offices, a large and growing number work in outpatient care centers or in private practice. It's a struggle, though. A report in Medscape on Monday, if you read that, would show you that physicians and insurance carriers both are pushing back against that trend. That's not really news. We've seen that here. There's certainly a lot to talk about regarding the future of nursing and the future of our own School of Nursing, and we have the right woman to talk with about all of that, although I was a little worried about it earlier on. I'm not going to lie to you, Yolanda. Maybe you know her as the alumna with 3 degrees from our School of Nursing. You might know her as a neonatal nurse practitioner, or maybe as a leader in our global education initiatives. And if you're lucky, you were in the audience like I was at last year's convocation, and you've heard her stirring discussion of social isolation and its effects on health. However you came to know her, Dr. Yolanda Ogbolu is the first UMSON alum to become dean of the school and is now in her 5th month as the Bill and Joanne Conway Dean of the University of Maryland School of Nursing. And she joins us now to answer Dr. Jarrell's questions and later some of yours. Now, if you've seen the program before, you know we'd love to hear your voice. Write your questions or comments in the chat area, and I'll be sure to let you know when we're getting ready to hear from you. And if you want to remain anonymous, that's okay too. Just let me know that, and I can read your question for you. Now, please welcome our host and our president, Dr. Bruce Jarrell.
Thank you, Alex, and greetings. It's a pleasure to be here and to be with all of you before this holiday. I have the pleasure of interacting with Dean Yolanda Ogbolu. Yolanda's been now Dean for 5 months in our very prestigious School of Nursing. And I think my first question relates to What's the first 5 months been like? What are you finding? What's the good, bad, and the ugly?
Sure. So, first of all, thank you, Alex, and thanks, President Jarrell, for that great introduction. Delighted to be here with you today. The 5 months been really busy. I've been doing a lot of listening to our faculty, our staff, our alum, the senior leadership team, and just learning more about the school. So it's been really exciting to hear about all the great things we're doing in research, from our research on pain to our research looking at virtual reality in combination with addictions and placebo care, as well as our research around maternal child health and community health. So we have a lot of great things going on here in the School of Nursing. We've been trying to address this nursing shortage that Alex mentioned by really enrolling more students, and I couldn't be happier to be here at one of the best schools in the United States for nursing, doing something that I really love.
Well, you must have had a surprise or two, though. It can't have all been routine, right? What surprises did you have?
Well, I think Jane left us in a really good place, to be honest. I've been going around all over the country, and, schools are reporting like low enrollment, but we're growing here. So, it's been really exciting because our school has grown more and more diverse. We're fortunate to be here in Baltimore, but also at universities at Shady Grove. And our student body has really changed a lot from what it was years ago in terms of diversity. So really, I think not really a surprise, but something that I see as like really pressing and needed is really making sure our students have everything that they need to be successful.
Yeah, I know this is off the top of your head, but how diverse are you?
Sure. Yeah, we're over 50% underrepresented minorities in Baltimore and over 80% at our universities of Shady Grove. And that's a big deal in nursing, because nursing is not a diversified profession. And many schools are really fighting to get diverse nurses. We want them to match the American population as they're providing care in the health system. But at the same time, many places are struggling with that. But if you get a nurse from UMB, you're probably getting a diverse nurse from UMB. So I'm thinking of us as also the place to come to find the types of nurses people are looking for.
Well, you're talking about men too, aren't you?
Absolutely.
So how's that part of it going?
Yeah, we have about 11% male nurses here in the School of Nursing. And again, that's really exciting. It's been growing. I think when I started 13 years ago, it was more like 3-4%. So we're making strides in really being able to encourage more men to nursing as well. So that's exciting.
Right. So it seems to me one of the challenges that we have in the professional schools is we don't have a lot of educators. We have a lot of people who are nurses or physicians or pharmacists or dentists or whatever, and all of them are trained in their specialty, but not so many are trained in the art of education. Tell me what your sort of thinking is on that and how that applies to nursing. And I mean both at Shady Grove and at UMB.
Sure, absolutely. I mean, as many of you know, because we're all impacted by nurses, nurses are everywhere. So if you haven't had contact with a nurse, you will have contact with a nurse in your lifetime. And so you know how much we need nurses, but in order to have enough nurses in healthcare organizations or in people's homes, we need to be able to educate nurses. But there's a gap between what the salary is for nursing faculty compared to what nurses make in practice. And it makes it really difficult for us to have enough faculty in nursing. And so that's something that is a big issue that's being worked on federally through federal legislation, really thinking about how do we fix the pay gap so that nurses are excited and they want to come to academia, and they also feel like they can be paid an equitable salary. Once they get here, we have to make sure they're prepared to teach, as in all the healthcare professions. Very often, nurses are not taught to teach. But we're really fortunate again here in the School of Nursing because we have the Institute of Educators. The Institute of Educators has been around for over 15 years and was really designed to teach nurses how to teach. And so we're really excited about the work that they're doing to support our faculty, but really they've been supporting faculty all over the state, teaching them clinical educators how to precept our students in practice. And now with some new foundation funds that we've received, we're starting an innovation grant that is going to be able to have a fellowship for nurses that will be coming into academia to begin teaching. So we're starting that in the spring. So that's exciting.
That sounds really exciting. So how would that work? You've already got your, what do you have, a bachelor, master's, or a PhD in nursing, and you then, tell me how that works. How's that work?
Sure. I mean, many of our nurses, the nurses that come and precept for us, the basic requirement is that they have a master's degree. And so nurses that have a master's degree may come and then pursue a doctorate degree once they come. About 80% of our nursing faculty here in the School of Nursing are doctorally prepared. And that's because that's the bar we've decided to set in our School of Nursing, to really have doctorally prepared nurses. And so when you come, like I did, I was a clinician, a neonatal nurse practitioner for 21 years before I came to academia 13 years ago. You need some extra support to transition. And so this fellowship program will help nurses that come and have a passion for teaching to really be able to gain the skills that they need to really perform at an excellent level that we expect here at UMB.
That's good to hear. I remember when I first went into medicine, not only did I have to do my surgery part, but I had to teach, and nobody prepared me for that. I might add, nobody prepared me to be a department chair or to be in the dean's office or be in the president's office. Maybe it shows, I'm not sure. But no. I think preparation is a good thing, and we seem to have left that out in our own institution. So part of this is making the connection with clinical arenas. And I know you've had a rich relationship with the medical center. So how's that going, and what do you foresee in that relationship for the future? Good things.
Sure, absolutely. We've been really excited about our relationship with the medical center and also with the medical system through a partnership that we call Nursing. And Nursing really functions on building collaborations, both in education to make sure that we have practice-ready nurses. We want to really have nurses that are ready to enter into clinical practice and transition well and be retained within the practice environment. So we partner with them on several programs to help nurses, our nursing students transition, things like the nurse residency program, the academic clinical education program. And the one that I really love is we call it the P3. And that one is really nice because basically it allows nursing students to identify a practice environment that they want to work in, do a practicum there their last semester, see if they really like it, if it's a good fit for the medical center, and also if it's a good fit for the students. And then if they're successful, they are automatically offered a position there. So that's really exciting. And Lisa Rowan recently wrote a paper that showed it's been over 200 nurses that have gone through that program, and they've retained 70% of them. So very exciting way to help nurses not only transition, but be retained in practice.
That's a good bet, a good investment too. So that's good. So I want to remind the audience to make sure you're getting questions into Alex because we're going to turn it over to you here shortly. Dean Ogbolu, it was 15 months ago when we had our first convocation, and you were one of the featured speakers there. and you did some time preparing for that. I wonder if you would tell me how you prepared for that and what your message was.
Sure. Well, thanks to you and to Alex and your team. It was really exciting to get to work with, Jerry Sandusky and others to really think about how to do a TED Talk, right? And what are the components of a TED Talk? So I'm really grateful for our great communications team here. But it was exciting to participate in the inaugural convocation and to really be able to tell a story that was important to me about a neighborhood that I grew up in, that I happened to be standing in at the time of convocation. And so it was really great to share my research around social isolation, because when I was growing up there, I had no idea that social isolation had such a substantial impact on health. And was as dangerous as smoking or high blood pressure. And now that I know that, almost in all my work, I do everything here in the School of Nursing, trying to build a sense of belonging. But I realize the importance of connections and connecting to others. So thank you for inviting me for the opportunity to do that.
Yeah, well, you came through with flying colors. It was really an outstanding experience, I think, for all of us. So now Alex tells me we're getting swamped with questions. So maybe what I'll do is, I got a bunch more too, but I think I'll let Alex ask a few audience questions here. Alex?
Well, I'm not going to ask them. I'm going to bring some people in.
Yeah.
I want to. Yeah, I mean, I'll ask them if people want. But Andrea Broussard is here. You know her, of course. Talking about the staffing question. Andrea, go ahead.
So thank you. I'm Andrea Broussard. I'm an associate professor. I mainly teach health policy. So I teach in the graduate department. I teach online students. I'm really concerned with my graduate students. They're all working nurses, and they tell me how difficult it is out there to be practicing. So I've really gotten a heart for nurse staffing. In fact, I wrote a blog for the American Journal of Nursing about nurse staffing. And I see a first step, not the only solution, but a first step would be the federal bill establishing patient to nurse ratios. So I'm looking for support for this bill from schools of nursing, from academic health centers, and because we need to support our students and our new graduates.
Andrea, can I just interject that you're referring to the Nurse Staffing Standards Act?
Yes.
Do you want to describe what that would do?
Right. So that would establish patient to nurse standards, such as ICU, 1 nurse per patient, ER, 2 nurses per patient, medical surgical, 6 nurses per patient. Currently, the only state that has similar legislation is California, but Oregon just passed a bill in August, and New York has a bill establishing staffing ratios for ICUs. It won't solve the problem, but it would be a first step. And I just have such a heart for this. Hearing the stories, I'm not practicing at the bedside anymore, but hearing the stories from my graduate students, how they go home and they feel like they missed doing care. They missed doing some essential care.
Sure.
So is there a question, Andrea?
Yeah, the question is, I'm looking for support. I'm looking for a formal support for this federal bill. And my other question is, how can we encourage nurses to run for office? Because right now we have no nurses in the Maryland legislature.
Sure, Andrea, I'm happy to respond to this question. The nursing shortage is really complex, and it has to do with production of nurses And, you know, as a school of nursing, we have a role in making sure we produce more nurses. We're fortunate we were able to increase our program in terms of entry to practice by 15% this year. We're really excited about our role for production of nurses, but we don't see that as our only role. We also partner with organizations like the American Nurses Association, the American Association of Colleges of Nursing, that also have policy arms that take up these really critical issues, because we know staffing is an issue, but staffing alone is not the issue. We're looking at nurse well-being as well. We're looking at things like workplace violence as well. And there are a lot of issues that are really driving the nursing shortage, and it's going to take multiple approaches to address that. And many places are doing a lot of great things to really be able to support our new nurses to be able to transition into practice, like the programs that we're talking about. The AACN and the ANA are all going out on these policy issues, as well as the Maryland Nurses Association that you're talking about. But we know that a staffing ratio alone will not be a complete solution. It really will require a multi-pronged approach.
Thank you. Alex?
I want to bring in Susan Dorsey. I'm so glad she has this question too, because we see this in social work, for instance, where people have an idea that this is a social worker, but it really can get you into many different areas, in your career, and nursing can be the same way. Susan, are you there? Susan, you have to unmute. I'm asking. I think you're there. Go ahead, Susan.
Me?
Yep.
Oh, great. Hey, hi, Yolanda. Great to see you, and great for to have this forum. Thank you, President Jarrell and Alex as well. So my question is, I know that we're always wanting to bolster enrollment, bolster new people coming into nursing. It's so important. And maybe I'd argue even earlier than at the high school level, we need people to start thinking about nursing careers. My work is as a nurse scientist is mostly focused on basic translational and clinical research. Are there areas that you see us nurse scientists could help you to improve enrollment? Because nursing isn't just about, when I entered nursing many, many years ago as a baccalaureate prepared nurse, it was patient care. And it wasn't clear to me, to Alex's point, the multiplicity of future roles that nurses could achieve. And so I'm just wondering, do you see a role for nurse scientists in helping to get people initially interested in enrolling in a nursing career and maybe opening their eyes to alternative paths once they decide that they're ready to move into maybe a more academic setting?
Sure, and thank you so much for that question, Susan. And first, I would start by applauding Cindy Wren and your department in translational science and research for the great job that you're already doing with University of Maryland College Park. We know that the students that come to our School of Nursing, they do 2 years at another university before they come here. So the students that come from College Park have been routinely partnering on research projects within your department, within the department that you work, and that's been just phenomenal. I attended this summer their session when they were sharing all their great research accomplishments. And when you get nursing students or pre-students excited about nursing research ahead of time, that's really exciting, because we know that on average, by the time a nurse gets a PhD is much later in their 40s. And that opens up the opportunity for enrollment for people that are as early as their bachelor's program, thinking about doctoral degrees, becoming nursing research scientists. And that's really exciting. That's just one example, but certainly research is a driver. I mean, that's the beauty of the nursing profession. That's why I'm happy to be part of it. There's so many things we can do, from working in the hospital to providing care at home to working in the library like our nurses do in community health, helping patients to really decipher and understand medical information. So absolutely, there's a role for research, for educators, for all of us. to really enroll students. And we're doing a good job with enrolling students right now.
Alex?
I think this is a time where, even though we've known you for a long time, right? But people are still getting to know you and kind of want to feel you out and where you're going. Let me bring in Merrick Moen, who, of course, you also know. You have all your faculty here. It's incredible.
Hey, now don't be stacking the deck too much with nursing people.
No,
Let's get some other
it's
schools
a,
here.
a good question, though. Merrick, are you there? Can you unmute your mic and join us? We're a couple seconds away from me asking for you. Well, okay. I'll ask her. She asks, what's been your steepest learning curve, and what would help shorten that curve for yourself or for others in your situation?
Sure. Yeah. I mean, I think it's been really incredible to have this opportunity in this special time to really listen. And to listen to a variety of people, from students to the alum. Even when you think about the nursing shortage, this is not the first time we're having a nursing shortage. So when I talk to alum, I talk to them and they make recommendations about things that we can do based on things that they did in the past. And so I've just really enjoyed learning from one another. From a business ops perspective, I've been in an administrative role for 13 years, from deputy director to director. So the business ops part is, was a little bit easier on the transition. But I think the challenge is really listening and bringing all these voices together to make sure I come up with a strategic approach that is really kind of collaborative and really works well for the future of nursing and for the future of the nursing profession.
I should note that Merrick says she couldn't unmute, so we had a disconnect somewhere.
Okay.
You wanted someone not in nursing. How about Valley Meeks? We love Valley Meeks.
Hi, Valley.
Got a dentist, right? Valley,
Yep.
Go ahead and join us. You're talking about the worker shortage also, but from a different angle. Go ahead.
Okay, I was wondering about what we're doing to get high schoolers interested in nursing. It's interesting that this past weekend, some friends of mine, we were having a discussion, and back in the 60s and 70s when I was in high school, many students that were interested in nursing, they would go to there was a vocational technical school that many of the students that wanted a career in nursing would go to that school first. Then upon graduating, went directly into nursing schools associated with hospitals. And then from there, I guess they got their LPN or whatever, and then from there went on to universities or colleges. I don't know if that's still the same path, because actually that was 50 or more years ago. But what are we doing to get high schoolers interested in nursing? Because I really feel it starts there.
Sure. Thank you for that question, Valley. And it's really interesting because I remember that as well. In fact, that was still happening when I was in high school. That Carver Vocational High School, if you finished that high school, you were a licensed practical nurse when you finished that. And I think Alex in his introduction, though, mentioned one of the things we've learned over time is that as the educational status increases to the BSN level, we have better patient outcomes. We have less errors and we have safer care. And so the bachelor's of education really, in terms of the American Association College of Nursing and others, is really the standard that we hope to achieve. Now, that doesn't mean that we don't have different starting points. I started as a nursing assistant working at Mount Washington Pediatric Hospital all the way through nursing school, and then had an AA degree at Baltimore City Community College. So there should be a trajectory from high school all the way through the community college to coming to places like University of Maryland to get that bachelor's degree. And we have a master's program, a doctorate of nursing practice, and a PhD. So there's lots of opportunity to advance. We have the Cures program here. I mean, it's a program that, the whole campus is excited about, where the students are recruited from middle school and are encouraged to go into health professionals, not just medicine, but to all health professionals. So, and we have several high school programs, including in Montgomery County, at our USG campus, that we've been working with. And a great superstar, Dr. Vanessa Foy, who's here, who has for at least a decade been working with high school students to encourage them to pursue a career in nursing.
Alex?
Yeah, there's the other end of the question, which is you were talking about recruiting, but then retention. Let's bring in Nneka Mitchell, who has some experience and some thoughts in that area. Nneka, go ahead and unmute and let us know what you think. Try it again. Nneka, are you there? Having some trouble connecting with people. All right. Well, I guess I'm going to be. I'm going to read her points also. She writes that she doesn't have statistics for nurse burnout and shortage, but it seems as if we're solving the problem, from one direction. But we should find out why so many nurses are leaving the bedside. It's like pouring water into a basket, she writes. So I think part of the problem with nursing is that older and more experienced nurses are in civil and sometimes in Hayes nurses. And that may be part of the problem why they are leaving. What do you have any views on that, on the working conditions?
Sure. I think, first of all, I want to just clarify a little bit of the stats about why nurses are leaving the profession. The recent research really shows that most of the attrition and the loss of nursing is due to retirements. It's very, and that's not to minimize these other things that are certainly happen, and the fact that nursing was heavily impacted, as well as other healthcare professions, by the pandemic. But the average age of a nurse is 54. And it's estimated that more than 600,000 nurses across the country will retire by 2027. And so most of the attrition is due to the aging nurse. And that's in part why the production is so important. It's really important for us to increase the number of graduates that we have, because these nurses, the baby boomers, are retiring. Certainly, there are things that need to be done to improve and promote well-being and healthy work environments. Addressing issues like workplace violence is at the heart of all of us in the nursing profession, making sure that nurses are treated with respect, and not just clinical practice, but also in academia. And so there's space to grow and work on that. And many of us are working on different programs to try to improve those issues.
I'm going to try one more time to unmute someone. Jeanette North. Jeanette, are you there? Ah, she is. Go ahead, Jeanette.
Okay, thank you.
Thank you.
I was just curious, it's for what does the journey look like for someone who would like to be in the nursing doctoral program, but may not have started their journey in nursing? So can I hear more about graduates and candidates who may have begun their journey in another discipline?
Sure, absolutely. So one of the things we've been really excited about for even our master's program is bringing in people that have bachelor's degrees from other disciplines. And not only is it good for them, but it's good for us because it brings depth and diversity into the School of Nursing. And for our PhD program as well, we also accept non-nurses into our PhD program, non-nurses that are qualified. Sometimes our PhD students have not pursued a previous degree in nursing, but might have an interesting research question or area of interest that pertains to health or healthcare or to nursing, and we welcome those students to apply to our program. We also have a lot of rich and emerging programs on campus as well for non-nursing. So when we think about UMB, we think about PhD and doctoral education, we think about UMB, right? And there's opportunities in many of the schools as well as in the School of Nursing.
We talk about interprofessional education, but Cynthia Boyle asked me to ask you, what about you and the other deans? Are you finding ways to work together, support each other, things you're working on?
Sure.
We have a lot of relatively new deans, don't we?
Well, I would say thanks to President Jarrell, that I think we're at a watershed moment, right? Because we have so many new deans coming on board, and we have new folks that are really here and ready to forge an exciting path forward. I've always collaborated with many of the schools on campus, so collaboration across schools is not new, and it's exciting to be able to work with the other deans. We meet routinely, we talk, we're ready to help each other out. In fact, as we've been having this discussion about the nursing shortage, I think about the social work shortage, because that's how close our relationship is. It's when we think about one school, we think about the other schools, and we're really thinking about UMB as a whole and how do we move UMB as a whole forward. And so the nursing profession is not the only profession that was impacted by the pandemic. It's not the only profession that is struggling with a shortage of healthcare workers. And some of the ideas, the models that they're trying in their school might work in nursing, and some of the things I'm doing in nursing might also work for them. So we try to work collaboratively together and identify solutions together.
And I hope one potential solution to that relates to community health and population health, as well as opportunities for our students to be involved in our own community kind of clinic. So to me, that is cross-disciplinary, and of course, nursing would play a key role in that. Alex?
All right, Kristen R. has a question. You were talking about this earlier, about preparing the teachers to teach, which I don't think we focus on enough, but this is kind of a softball to both of you, because I know that's a subject close to your heart, Dr. Jarrell.
Yes.
Kristen, are you there?
Yes, can you hear me okay?
Absolutely.
Awesome. So, hi, Dr. Ogbolu. I was just wondering, we've talked about the changing face of students and their challenging situations that they're facing. How can faculty best prepare themselves to support and teach the students of today and the challenges that they face?
Sure, yeah. As I've been meeting and talking to faculty and to staff, I've been talking a lot about the social determinants of learning. People have heard me talk about the social determinants of health, but many of the social determinants that also impact our community also impact students here. A few years ago, I did a conference with students around hunger, and it was a global health conference. And I thought we were going to be talking about global hunger. And the students started saying, well, I'm hungry too. My food runs out. And so I think it's really important for us to understand that if a student is hungry, it's really difficult for them to learn. Or if they're worried about housing. And so many of our students do have to work because they have families that they have to take care of. And so really paying attention to the social determinants of learning and making sure that we have resources that can support students. Here in the School of Nursing, we have a student emergency fund. And that's a place where students can go when they get stuck and they really need support. To obtain additional resources, and we're fortunate to have received some foundational funding to support that fund. But it's really important for us to think about and kind of meet our students where they are. Again, a lot of times when we think about diversity, we're thinking about race and ethnicity, but are we helping students that are parents? Are we helping students that are military? Are we thinking more broadly about our students and what they might need to really be successful? And then just really making sure that we develop those meaningful relationships with students so that they trust us and they can come to us and they know that we want them to be successful.
Those are terrific answers, Yolanda. I just have to compliment you on them, and a lot of stuff packed into that and a lot of things we have yet to do, but great answer. Thank you for that. Alex?
We talk about this nursing shortage as sort of an amorphous national issue, and it is a national issue, but our primary focus, of course, is Maryland, the health of Marylanders. David Brooks writes, is Maryland, the shortage of nurses in Maryland, forecasted to be long-term or short-term, and how can UMB address this in both terms, both short and long-term? And if the school requires growth, it's already a big school, how much is anticipated?
Sure. Yeah, I mean, you raise a good point. I was on a webinar with HRSA this morning, and they were talking about the nursing shortage and really talking about the nursing shortage varies across states, and that on a national level, sometimes we're treating it like it's a one-size-fits-all. But it varies across states, and then it varies within states. And one of the interesting conversations that came up was about rural populations. And that, sometimes there's really issues in terms of the distribution of nurses, where nurses are largely in urban communities and not enough nurses in rural places. Like, think about the Eastern Shore and some of our counties down on the Eastern Shore, and whether we have enough nurses in those areas. So they're finding that, we have to think about this differently, think about it more broadly, really dig in and get state data. We have at the School of Nursing at our Shady Grove campus, we do have a nursing workforce center, and they're working to gather some of this data and develop a dashboard so that it's more visible. And so that's some place that we're also supporting, trying to understand this issue around the nursing shortage, but it's more complex.
Alex?
Yolanda, you know Florence Okafor, don't you?
Florence Okafor, name sounds familiar.
Okay, well, I'm going to bring her in. So Florence, go ahead and unmute.
Hi, Yolanda. Hi, this is Florence. You might know me with my maiden name, Nwoga.
Yes.
I should have said that. I'm sorry, Florence.
It's okay. I didn't put it in the chat. Nice to meet you virtually, and I made a point to attend this. We kind of went on LinkedIn. So as you know, I'm a UMSON alumni and also a previous adjunct at the University of Maryland at the School of Nursing. Now I'm still in education, but in the hospital setting, from an NPD standpoint. So my question is, in 2005, only 35% of the new graduate nurses were being practice ready, and then fast forward more than 10 years later in 2017, that number dropped from 35% to 23%. So my question is, what are we doing? And we mean, I still say we because I'm, alumni at heart. What is the School of Nursing doing or has done to academically prepare nursing students to be competent bedside practitioners upon their graduation?
Sure. No, thank you so much, Florence. It's always great to have our alum join these calls as well. So I'm happy to have you here. I think it's on all of us. I hear you saying you're an educator in the clinical setting. I think it's really important that we're all involved. But one of the really exciting things in nursing right now is that we're moving to competency-based education. And we're moving into a model through the American Association College of Nursing in terms of our teaching and ensuring that nursing students not only know it, but they're able to show us that they know what they know. And so they have to be able to do it and perform, and we have to make the space for them to really be able to demonstrate that they know the competencies before they graduate. And that's a major stride towards being more practice ready. And the School of Nursing has been number one, and moving this forward with the AACM. We're one of the first schools to have had our curriculum approved for competency-based education, and to also have it approved by the Board of Nursing and MHEC here. And we're in the second year of implementation for our bachelor's program, and we'll start implementation for our master's program this spring, and the doctoral program in the next year, 1 to 2 years. So we're moving and we're making progress on that. And of course, we'll be able to track it and measure the competencies as they graduate. And that's going to be really great for us. But Florence, I'm glad you're here because it also requires connections with practice partners, right? To help us make sure that the way that we're evaluating the competencies are appropriate for practice. And so it does require more connections with practice. And so we've been partnering in UMMC with our practice partners to develop these competencies, but we also welcome input from our alum.
And one thing, Yolanda, that the prior speaker asked about was growing your class size. Now, you and I have talked a little bit about that. Tell the audience how big your classes, both of them, are now. And what's your major limitation to growing larger?
Sure. We have 2,100 students in the School of Nursing right now. We're one of the largest schools on campus in terms of the number of students. We decided we would increase from 100 to 110 students in our bachelor's program. We ended up with 117. And, you know, I was sharing with President Jarrell, so much so that our classroom was overcrowded and we ran out of seats. And so as we grow, we need more space. We need more space. We need more clinical preceptors. We also need more space for our simulation labs so that students have enough time to practice. We not only increased in Baltimore, we increased in our universities of Shady Grove. We increased in our entry to practice. So in total, the number of students we have for entry to practice this semester alone, we admitted 272 new students. And so that was huge for us. And we do that because the University of Maryland School of Nursing contributes 40% of the nurses to the state of Maryland. And so the state expects us to really help, and we want to help and be there to make sure that Marylanders have enough nurses to receive the care that they deserve.
Thanks. Is there a better way for you to enlarge your class? So if you look 10 years down the road, what do you think you'll be doing differently?
Well, I think that, that's a great question. And it is the future of healthcare in my mind is in the community and in primary care. And I think we will grow more in terms of being able to deliver care in the community. We know that new models of care are popping up, things like something called dispatch health, where you can use a Uber type platform and you can have a doctor or a nurse practitioner and somebody from the lab and the x-ray come to your house and prevent you from having to come to the emergency room. And I see really futuristic models like that popping up 10 years from now. Dispatch Health is already in 12 states across the United States. And so that's a model that I do see growing. In terms of our School of Nursing, I think we will continue to grow as much as we can. There may be some limitations to our growth, due to constraints on our space and our ability to get clinical sites. And as other schools pop up, competition for those clinical sites. But we're committed to doing what we can to make sure that Maryland has enough nurses.
Great, thank you. Alex?
I'm excited to bring in another faculty member, Doris Titus Glover, because I really hope she asks the very last part of the question she put in the chat. Doris, are you there? You can go ahead and unmute and ask your question. I see you there, Doris. Go ahead. Nope. Her mic was open, but she, I'm going to give you one more shot, Doris. Oh,
Is that better?
yes, better. There you go.
Yes.
Wonderful, wonderful.
Good,
Good
go ahead.
afternoon, President Jarrell and Alex, and good afternoon, Dean Ogbolu. It's really very exciting to have you as our new dean all of these 5 months. You know, to most of us, you've been a great role model, whether with our research, teaching, and even with our mental health. So, I mean, I would dare to ask, you know, what excites you about your new role? And then secondly, I also want to know how you feel at the end of the day. This is kind of a check-in question, and I hope you're able to respond to it. Thank you.
That's what I wanted to know, yeah.
Well, you know, I mean, part of why I decided to apply to be the dean is I asked the same question. What excites me at the end of the day? I think we all like have turning points in our life where we sit back and we reflect about what brings us joy in life. And I started reflecting and I noticed it's when I'm able to help a colleague. It's when I'm able to uplift a faculty member's research or just really cheer a student on. And that's what really made me want to become dean of the School of Nursing. And I still feel that excitement every day as I get to speak to even more people, you know, alum and other stakeholders, and to really, you know, elevate how great the School of Nursing is, how great the nursing profession is. And then at the end of the day, how do I feel? Some days I feel exhausted, if I can be honest. You know, it's exciting, but I have to remember, as I'm so fortunate to have President Jarrell leading me. He tells me, take a vacation, make sure you get rest on the weekend. So I really enjoy the work and the excitement keeps me going. You know, I'm just happy to be here. But I do remind myself to take rest and to take consideration of my well-being. And for my colleagues from the School of Nursing staff and faculty, you all know that I've been singing that song to you. And the best way to encourage your well-being is for me to be a leader in that area as well.
Yeah, I think COVID really brought that out, don't you think?
Mm-hmm.
I mean, maybe some of us weren't taking such good care, and COVID just pressed that issue. And you were working how many hours a day to just keep things afloat? And you got to step back and take some time away, no question about it. So I hope you're doing that. Alex?
I knew somebody was going to mention leaps. And I'm glad Christina Sestone
good.
did. Christina, go ahead and unmute and ask your question.
Unmuted.
Yes, you are.
All right. Well, hello, Dean Ogbolu and President Jarrell. This has been a really great discussion. Thanks for taking my question. You knew I would ask as a former council representative on the Leaders in Education, our Academy of Presidential Scholars. How do you envision this entity, as well as even by extension, our health professions education program in the graduate school, complementing the School of Nursing efforts for faculty development and preparation for teaching roles given the shortages?
Sure, absolutely. Thank you, Christina, for that question. You know, I was fortunate to sit in on the council, and it was really helpful, not only to me, but I know quite a few of our faculty have been involved, you know, and there's not one or the other. I think the work that you're doing to really support our faculty have been well received here, and we look forward to those ongoing relationships. And especially building some synergy between your LEAPs and in the Institute of Educators. So absolutely, we're looking forward to partnering. I just saw that you sent out something for the 20-minute mentoring on Mondays, and I'm really excited about listening in on some of those sessions as well. So absolutely, we'll need your support. So thanks for the offer.
Great. Alex, time for one more.
I guess we have time for one more. We have a 2021 alum, Teresa Graves. Teresa, go ahead and unmute your mic. There you go.
For the invite for this panel discussion. I am alumni from 2021, and Dr. Ogbolu and Marie Moore were both of my professors. But I'm just, so in my current role, I actually oversee a few primary care as well as ambulatory specialty clinics. And Dr. Ogbolu, you actually just kind of touched a little bit on this. So my question was around, is there like more efforts or initiatives or education being provided for students for the primary care, kind of more ambulatory type settings as we face this nursing shortage? Years ago, we were told that nurses couldn't start off in the ambulatory setting, that they needed to have years of med-surg, but you know, things are changing now, and we definitely feel it in the primary care and ambulatory arenas. And oftentimes we have recruitment challenges of new grads. So just wanted to hear your thoughts on that.
Sure. Thank you so much, Teresa, and great to have you here. You know, as I said, the future of care is in the community, and that includes primary care. And so we certainly need nurses that are prepared for primary care. It's interesting, that was a thing. It goes back probably before I was a nurse, but certainly I heard it as a nursing student that you needed to do 1 year of med-surg before you could go to primary care. And I think there's a shift in that thinking. And I mentioned earlier, I'm not sure if you were here, about the P3 program. We found that if nursing students get quickly linked into departments or areas where they have an interest, that it really increases retention. And so I'm really excited about how can we help nurses to transition into places where they have passion. I had passion to be in the neonatal intensive care unit. And so I took care of premature babies from when I finished nursing school throughout the 21 years of my career. And I was well suited for that because I really love taking care of those little babies. Not everybody can do that. And many of our students do have a passion for primary care, for behavioral health, for mental health. And so making sure that we're able to help them transition into the areas that they love as soon as possible will help us to be able to retain them long into the future.
Great. Well, we're out of time. The time flew quickly. A lot of good questions, and Dean Ogbolu, a lot of good answers. I appreciate that, and maybe we'll have to have you back on for some harder questions. So, in any event, thank you all for being here. Yolanda, thank you for being on this, and I look forward to our next one. Thank you all.
Bye-bye. Thanks, everybody. Bye-bye.